Good morning, everybody. It is Wednesday, November 25th. You will hear noise in the background. I'm a little bit late starting. We have two trees that are about 160 years old in front of the house that are being brought down by the tree service. The city marked them for removal. They're kind of hollow and they're old. So they kind of just grow vines on them. So if you hear saws and chainsaws and thunks and chunks in the background, that's pieces of two old trees hitting the pavement on the street. So we had an interesting, somebody actually put this up a couple days ago, so I looked into it. Cleveland Clinic, talking about melatonin. I'm not going to say they're going to say treatment for COVID-19, but sort of, I guess. And the gist of this starts, we'll start back when they started looking at this. Because Cleveland Clinic came up with a model. I tried to do it on myself, and I guess I'm not alien enough for them to give me a risk factor chance of getting infected with coronavirus, or COVID-19 specifically, is what it's for. So I put my little numbers and my age and all that in, and it said there's not enough information about you to give a risk percentage based on the COVID-19 risk model. But they have developed a model. They are on the Epic medical record system. I guess that's 250 million records worldwide, and they've put that model up on Epic. So anybody that has Epic, I trained on Epic. It took a while when I was at Mercy Hospital in Oklahoma City. So there's there's a button on there if you have an Epic record called My Chart. And you can get to that model from the Cleveland Clinic on My Chart in Epic. So if we go back through how they started doing this, it goes back to June 15th of 2020. And on the Cleveland Clinic Learner Research Institute, they talked about developing their development of the first model to predict likelihood of testing positive for COVID-19 and disease-related outcomes. Okay, so this is this was published in Chest, a journal for pulmonary medicine. So it shows the relevance, this model of age, race, and gender, socioeconomic status, vaccination history, and current medications. And so that's where it got interesting. They started looking at what FDA-approved medications a person were taking or was taking or is taking, and they found about 34 medications that seem to alter the outcome of COVID-19. So the quote from this is Laura Gihai, Cleveland Clinic Chief Research Information Officer. She says the ability to accurately predict whether or not a patient is likely to test positive for COVID-19, as well as potential outcomes, including disease severity and hospitalization, will be paramount in effectively managing resources and triaging care. And so back then they were talking about a potential second wave, which the media is telling us we're in a worse wave, I think, than we were last spring. However, remember, the case fatality ratio is still pretty flat. So you're, if you test positive, you get a 99 point something percent chance of coming through it. Now, I do have two family members that have succumbed to COVID-19. They were both older, but and had some comorbidities, but overall, the case fatality ratio, I think they were publishing at like 4 or 5% last April, May, and it's less than 1% at this point. Okay, so this nomogram, and they do have an online risk calculator. So if you go to the Cleveland Clinic, if you don't have an Epic medical record, then you can go to the Cleveland Clinic and search out this nomogram or online risk calculator. It was developed from 12,000 patients enrolled in the COVID-19 registry for the Cleveland Clinic, and that also included all patients tested for COVID-19 at the Cleveland Clinic, not just those that were positive. Okay, And then they used statistical algorithms to transform the data from the registry into the first of its kind nomogram. So what it found, this is June 15th, 2020 when they published it. So they found some novel insights into disease risk for COVID-19. There's four of them that they talked about back then. So one, patients who have received the pneumococcal polysaccharide vaccine PPSV23 and the flu vaccine from last year were less likely to test positive for COVID-19 than those that have not been vaccinated. And of course, Pfizer is in the news for developing a rapid COVID-19 vaccine despite working for years since 2002 when the SARS-CoV-1, the initial big coronavirus infection started in China back in 2002. So they've been working on a messenger RNA vaccine for that coronavirus all these years and haven't been able to do it or come up with one. And now supposedly we have one for SARS-CoV-2 in less than a year. Probably not available to the general public until summer or maybe fall of 2021. Okay, number two from data in June of 2020. Patients taking melatonin, an over-the-counter sleep aid, and we've talked about it on 2 or 3 different classes, or Corig, which is a beta blocker for high blood pressure and heart failure treatment, or paroxetine or Paxil, which is an antidepressant, are less likely to test positive than patients not taking those medications. Number 3, patients of low socioeconomic status, which was done by zip code analysis, are more likely to test positive than patients of greater economic means. And number 4, patients of Asian descent are less likely than Caucasian patients to test positive. Okay, so that's what started them thinking about, okay, so maybe there's things that we can do with FDA approved medications that are FDA approved for not COVID-19. There isn't one. So what can we do to repurpose FDA approved medications to help against this pandemic? Okay, so as COVID-19 continues to spread, and so what we have now is being termed a fall surge, they looked at repurposing drugs already approved by the FDA to see if they are efficient or cost effective. This is where the melatonin thingy came in. So this was published in, let's see, like November 6th, 2020, in PLOS Biology. And it was an artificial intelligence program that they developed at the Lerner Research Institute at the Cleveland Clinic. And it shows that repurposing has revealed through that algorithm that melatonin is a promising candidate. So Dr. Williams in Oklahoma City and me, we're talking about 5 milligrams of melatonin last March, I believe. That's still on my COVID protection protocol on Fullscript, along with zinc, etc. All the things that I've told you about. So analysis from their patient data. So this is the Cleveland Clinic's COVID-19 registry. Revealed that melatonin usage was associated with a nearly 30% reduced likelihood, so it's 28% is the actual number, of testing positive for SARS-CoV-2 after they adjusted for age and race, smoking history, and various disease comorbidities. And then notably, the reduced likelihood of testing positive for this virus increased to about 50% for African Americans when adjusted for the same variables. Okay, Dr. Chang, and I'm not going to destroy his first name, I think it's a guy, I can't tell. Dr. Chang, who is assistant staff in Cleveland Clinic's Genomic Medicine Institute, and he's the lead author of the study. His quote is, "It is very important to note that these findings do not suggest people should start taking melatonin without consulting their physician." Okay, well that can be true. I mean, you should always tell your physician what you're taking supplement-wise. or ask their opinion. It's whether or not they've read up on melatonin and coronavirus, I suppose. But melatonin is over the counter. You can get it at a Love's, or you can get it at Pilot, Truck Stop, all that. I've seen all those all those supplements available where you get your gas. Not every place, but so he goes on to say large-scale observational studies and randomized controlled trials are critical to validate the clinical benefit of melatonin for patients with COVID-19, but we are excited about the associations put forth in this study and the opportunity to further explore them. So once again, I looked at a fact-check thing through USA Today. Let me see if I can pull it up and tell you. Okay, so the fact-check from USA Today is saying that there's not double-blind, placebo-controlled, randomized studies. So they rated it as missing context. So we rate this claim missing context because without additional context it may be misleading. Okay, so a recent Cleveland Clinic study did find melatonin usage associated with a reduced likelihood of a positive COVID-19 laboratory test, but because the study was observational, it does not prove causation. That's a true statement. And then they go on to say randomized controlled trials are needed to establish a link between melatonin usage and COVID-19. Okay, well, if you've bought melatonin over the counter, it's inexpensive. And so doing double-blind and randomized placebo-controlled studies is way expensive. And so one of the reasons supplements are not studied to the level of what a pharmaceutical FDA-approved medication is the expense involved in those kind of trials. Okay, so I can't imagine anybody that manufactures melatonin is going to do a $1 or $2 billion study to sell you something that will cost you $5 for a 30-day supply. Okay, so they had some other medications that they talk about. So there are 34 different drugs used to treat a variety of respiratory, cardiovascular, neurologic, immunologic diseases, as well as cancer. And so some of the antihypertensive drugs target the angiotensin receptor. And the spike protein on COVID-19 uses the angiotensin converting enzyme type 2 receptor to gain access to a cell. Okay, so there are ACE, it's called ACE, receptor blockers that are used for hypertension management. So that has some interesting possibilities. And I told you I take irbesartan for high blood pressure as well as the beta blocker. And so I think I sort of maybe have a little bit of a protective effect from the irbesartan. Now the problem is we've talked about vitamin C, high-dose vitamin C, which is necessary for immune response. So as soon as you start getting sick and your immune response kicks in, you almost develop scurvy. So your vitamin C levels go down. You have to upregulate your vitamin C intake significantly if you start getting cold symptoms, flu symptoms, COVID-19 symptoms. And then the other thing, so that's to boost your immunity. And then the other thing is zinc. Well, zinc is water soluble. It's not lipid soluble. And your cell membrane is a phospholipid bilayer. Okay, it's got cholesterol in the cell wall to help make the cell wall less rigid. It also protects from nasty things getting in your cell. But this COVID-19 thing is using that ACE receptor on the cell membrane to gain entry to the cell. Zinc will prevent viral replication, but it has to get into a cell. So that antibiotic that was such a big thing last March, and I'm not even going to mention the name, so I don't want to get tagged on it. But that particular antibiotic works. It's not the antibiotic. It's working by helping zinc get into the cell. So water-soluble zinc needs to get through a phospholipid bilayer in order to get into the cell and prevent viral replication. So that antibiotic is one way to do it. Quercetin is another way to do it. Fish oil, omega-3 fish oil will help. Black seed cumin oil, all of those we've talked about. So you've got several options for zinc ionophore activity to get zinc into the cell and fight viral replication. Well, it turns out if you take melatonin, so 5 milligrams is what I've talked about, and if you have trouble sleeping, 20. So the sleep-inducing dose is 16 to 22 milligrams. That's from age management research. So 5 milligrams will probably do it. If you have trouble sleeping, triple that or even quadruple that. Okay. So just some interesting stuff from Cleveland Clinic. They don't, and I couldn't find the actual study. I didn't go through PubMed to find and read the actual study, which is my bad, to see what the other 34 medications, okay, that they are talking about. So what they did was look at autoimmune diseases like inflammatory bowel disease, pulmonary, chronic obstructive pulmonary disease, fibrosis, depression, ADHD. There's kind of a network proximity to SARS-CoV-2 genes and proteins, and that's how they identified the 34 drugs as possible repurposing candidates. And melatonin was the chief one that they found the best results on. So again, it's not a take melatonin and you won't get sick, but it is part of that COVID-19 protection protocol that I've been talking about, and kind of putting, adding things. I haven't really subtracted anything, but I've added some stuff to that COVID-19 protection protocol. So vitamin D is one of them, vitamin C, quercetin, black seed cumin oil, and oil, omega-3s, zinc, melatonin at 5 milligrams. And then I put a multivitamin, and I also put some elemental supplements as well, one of which is magnesium. So vitamin D uses magnesium and vitamin D work together on a significant amount of reactions. We just talked about vitamin D in physiology class, I think a couple of weeks ago. So vitamin D and magnesium kind of work together. So that was why the elemental supplement was in there. Or you can take magnesium 400 once a day just by itself as its own supplement. Easiest way to do it is drink it with CalMag, calcium magnesium. There's a product called Calm. You can find it on Amazon, and you just drink it. You mix it in about 3 ounces of water in a glass, and you don't use a metal spoon, anything metal to stir it up, and you just drink it. So that'll get your magnesium level up, and those of you constipated, will help you go to the bathroom the next morning. So that's a real quick little primer on what's coming out of the Cleveland Clinic. So that was encouraging, since there's some basic research that was suggested that melatonin would do this, and then Cleveland Clinic used their COVID-19 registry to actually show it. So once again, check with your doctor, especially if you're on any other medications. And if I can find the other 34 medications, I'll put a list up. I just haven't found it yet. I decided to do this morning. I'm giving tests online most of the rest of the day, so if any of you guys want to take an anatomy test, let me know. Otherwise, have a great Thanksgiving. Don't eat too many carbs. That's the biggest problem. Everybody thinks you get tired because you eat too much turkey and tryptophan in it. That's not true. Most people jump their caloric intake to about 4,800 calories on Thanksgiving Day, and lots of it is carbs. Okay, so carbs make you tired. That's how it works. So I'll talk to you Friday. I'm going online virtually at State Fair Community College on Monday, and then we'll see how the high school goes as far as getting called in to substitute teach. So I'm trying to stick with this Monday, Wednesday, Friday at 9:30, but I may have to switch to Tuesday, Thursday. I'll just put it up ahead of time and let you know. So have a great day, have a great Thanksgiving, and I'll talk to you Friday. See ya. Bye.